What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering what is the skeletal survey. So this infamous exams, it comes with a lot of bones, a lot of x-rays, and there's different versions of the skeleton survey. There's the long bones, there's the one that is a true skeletal survey, and you include the spine, the head, and then if it's like the long bones, you'll do from like the extremities, from like your humerus, like the whole arm, AP lat, the other one, the legs from like the femur down, AP and lats, and then the spines, I think it's just like I think it's just an AP. Yeah, AP on all the spines. And then there's like the one for when someone has scoliosis and they're trying to look at their spine. So that one will involve all the way from like well, I guess it depends on where they have their like scoliosis or their spine is messed up. But some places they'll have them from like all the way from the C spine all the way to the L spine, and you just go all the way down. Or other places, if it's just mainly their the T spine and L spine, they'll just do that. Or so sometimes they'll order it on babies. I've had one ordered in the NICU, and since the baby's so tiny and they're within like their body's still developing, I would always make sure to ask either the nurses or the doctors, whoever ordered it, what exactly they want. Because like if they're like, oh yeah, just do skeletal survey, and they just needed the x-rays of like their appendages, well, there's no point of you doing a true skeletal survey involving the whole spine, the head, and then like doing all this other stuff and just causing extra dose. Because sometimes what they order isn't what they want because they don't know what to order, but they know what they want. So it gets complicated. At the end of the day, we are the ones who give patients the radiation, and it's kind of up to us to kind of make sure that we're doing enough, and also especially with babies that small, that you do it's ethically correct. So if you're curious, I am a night shift tech. I've been doing it for about 4 years and work a lot of overtime, so I dabble in both the daytime and the nighttime world. If you're still here, I appreciate you as I continue to educate you in this beautiful field of radiology. I do this because most people in our field don't have someone to look for with knowledge, especially newer videos. My lady's a nurse, and in her world there's so much nursing videos, too much stuff. I mean, granted, their field is a little bit more complicated than ours, so I would understand. And there is more nurses than there is x-ray techs, but I feel like it's up to me to educate people the best of my knowledge. Because I mean, there was some stuff when I was a student, or when I was still trying to see if I wanted to do this career, no one can answer none of my questions until I actually went to clinicals, or I started talking to teachers about my profession that I wanted to be. So here I am giving you the knowledge. I will never charge anyone for this. I was thankful enough that I learned from a lot of people, and I grabbed the knowledge. And yeah, I'm just here giving back to the community. And yeah, it's been your boy Miguel. We'll see you on the next one.